Hi, I'm Dr. Genevieve Mellons from Psychology Australia. In this session, I will be talking about dependent personality disorder. While dependence on others is appropriate for children, dependent personality disorder is an excessive fear of separation and a need to be cared for that leads to submissive and clinging behaviours found in adults. Sufferers from this personality disorder find it difficult to make everyday decisions and want lots of advice from others. They usually fixate their dependence on one other person, such as a spouse, and passively accept their opinions about what they should start, what they should do, where they should go, where they should live, and who they should mix with. They have difficulty expressing their own opinions and fear the loss of others' support. They feel very uncomfortable being alone and think that they cannot cope on their own. When one dependent relationship ends, they will quickly move on to the next. Dependent personality disorder is among the most frequently reported personality disorder found in mental health clinics. When making this diagnosis, it is important not to confuse cultural factors that impose a high level of interdependence or age-related factors such as the elderly who do need care. Sandra was a gorgeous woman in her mid-30s who was brought by her current partner to my psychological practice. He informed me that when she started the relationship, he found her dependence on him charming. But as she became more and more clinging, he started to understand why previous relationships had failed and why she had been physically and mentally abused. He couldn't understand why she would cling to him, even when he became a bit mean. Although he appreciated the acts of kindness that she did for him, he had become tired of making all her decisions and wished she would grow up and start taking a bit of responsibility for herself. For her part, Sandra told me that she was terrified of losing Brian, her partner, and couldn't understand why he was pushing her away all the time. Even though she was quite intelligent, she would sometimes play dumb because she was afraid that if she disagreed, she would lose her partner. Superficially, Sandra was easy to treat because once I had gained her trust, I found that she became dependent on me. For a while, I was able to use this factor to help her to increase her confidence, take responsibility for herself instead of looking to others to make her decisions for her, and to generally toughen up. Of course, I then had to decrease her dependence on me and initiated scenarios where she had to defend herself and her opinions against me. With treatment, Sandra was able to decrease her dependence on her partner Brian and learn to stand up for herself. If you think you or someone you care about may be suffering from dependent personality disorder, then I recommend you have a chat with a psychologist because professional help is available. Thank you for listening. Remember, there is lots of other free helpful information on the Psychology Australia website.